Good evening, everyone. I'm Tegan Taylor, health and science reporter for the ABC, and I'm delighted to be hosting another of our popular MedConnect events from UNSW's Faculty of Medicine and Health. Our topic today is one I'm particularly passionate about: food on the front line of health. I have some world-renowned experts joining me tonight where we'll be exploring how the power of nutrition can be harnessed to revolutionise health and wellbeing. Before we begin, I'd like to acknowledge the Bidjigal people that are the traditional custodians of the land I'm on tonight. I would also like to pay my respects to the elders, both past and present, and extend that respect to other Aboriginal and Torres Strait Islanders who are present here today. Now, we're going to be taking your questions tonight, so please submit them for the panel via Slido. The hashtag for the event is hashtag MedConnectFoodHealth. MedConnectFoodHealth. A reminder also that this webinar will be recorded and made public following the session. But now let me introduce the panellists joining me this evening. Welcome Professor Jason Wu from UNSW's Faculty of Medicine and Health. Jason is also head of the Nutrition Science program at the George Institute for Global Health. His research focuses on improving health and wellbeing, food policies, and figuring out how dietary factors drive or prevent diseases. Jason's research has shaped nutrition guidelines and policies in Australia and globally. We also have Vanessa Matthijssen from Deloitte. Vanessa leads the consumer products industry for the firm and is a senior strategy partner. She has more than 20 years' experience in consulting and is currently working with agriculture, food and beverage and grocery companies to help create a world in which food is produced and consumed in a way that is affordable, healthy and good for the planet. She's also the lead author of Deloitte's Future of Food series, which explores commercial opportunities for food businesses while allowing them to advance society and sustainability. So thank you both for joining us. The perfect brains, I think, for this discussion. So let's kick things off. I think we might start with you, Jason. We're talking about the role of food in health tonight. How much of a contribution does food make to our ill health at the moment? And how much of a difference would it make to our healthcare system if we were to change the way that we eat?
Absolutely. Thank you. It's an absolute pleasure to be here tonight with you and Vanessa. So, massive, right? It's the only way to put it. So, globally right now, about 11 million deaths, premature deaths, right? 1 in every 5 is attributable to what we call suboptimal diet. So, essentially eating not enough of the good things like fruits and vegetables, and too much of the unhealthy things like sugary drinks, right? So that's the global picture. Australia is no different, right? So in terms of our top diseases that are imposing a severe burden on our healthcare, cardiovascular disease, type 2 diabetes, certain kinds of cancers, a lot of it is driven again by unhealthy diets. So for us as a society going forward, I mean, recently with the COVID pandemic, how much strain our healthcare has been put under as well. It's just not going to be sustainable unless we can get on top of this issue of suboptimal diets and make sure that we can really shift the whole population in the right direction.
Vanessa, how does that fit with the work that you're doing?
Quite a thing for me to make sure that this industry that I work with every day, it's the retailers, their food producers, manufacturers, their agricultural companies. I'd like to actually think, as much as I agree with the picture that you paint, that they're not just a major problem, but they can actually be a solution. And that's a solution for a sustainable, a healthy planet, but in particularly sustainable health of individuals. And that's one of the reasons why I'm so pleased that I can be here tonight to actually talk about that.
So Jason, part of your work is modelling what different changes might equate to if we change things in the food supply. Where is the biggest bang for buck if we were going to make a change in Australia?
Yeah, definitely. So I like to use this analogy as a food-based one. So what drives our dietary choices, right? As obviously we're individuals that make our own choices. It's kind of like an onion, actually.
Okay,
so
nice.
there are many layers.
It's fragrant.
To it, right? So a good way to think about it is that obviously we need to have the knowledge, having the education to sort of know what foods are good for us and not good for us, right? But if you go one step further out from that, right, there's your family, there's the cultural influences around what is considered healthy foods, what you should be eating. If you go a little bit further out from that, right, at the community level, where you live, right, what postcodes and what area you're in, even if you had the right education and knowledge can you actually afford to buy the healthy foods that are out there? Do you have a supermarket that's close to you that makes it easier for you to get to? Going further out from that, right, government policy around incentivizing the production of healthy foods versus less healthy foods, all the way through to global trade agreements and how that can influence the kind of foods that are accessible to us. So I use that analogy and I point it out because it's complex, right? It's a what we will call a wicked problem, right? How do we actually help communities and populations improve their diet? And the short answer is that there's no one size solution that's going to fit it all. We need to have a solution targeted at the individual, at the community level, and also at the government societal level. And just some examples around that, right? We could reformulate our food products that are currently in the supermarkets, where we gradually take out some of the salt, gradually take out some of the added sugar. Over time, we can actually shift the entire food supply in a healthier direction, right? That's a good example of the kind of thing that would be really good bang for our buck in terms of lifting everybody's health at the same time.
Yeah, and one of the things that we love as well is a concept called behavioural economics, because I think that has a major role to play to make sure that in the moment you actually make the right choice. And we're all different, right? We have different habits. We respond different to different things. So understanding what actually works for you and making sure that we have the right nudges in place, I think is going to be a big game changer when it comes to the diet.
Go for it.
Please.
So,
I mean, I absolutely agree with that. I mean, I think the intent gap, right? I mean, all of us work hard, right? And many of us work hard. You get home at the end of the day, you're tired. You still have to make decisions about what you're going to eat for the night. So those nudge kind of interventions around designing your immediate home environment, for example, or workplace environment, so that the healthy choice is sort of the default and easy choice. It fits with that sort of nudge thinking, right? So one thing that my work, for example, the George Institute does is that we regularly have fresh fruit that the work buys and just puts out on each level of the floor, so that, if I'm hungry, I've been sitting at the desk for a couple of hours, get up, there's a banana, there's an apple, right? It seems simple, but it really kind of takes away some of that temptation, if you like, in terms of, I may have had a moment of weakness, but I can just reach for that fruit and that's going to be good for me.
you can't just walk around holding your breath all the time, right? It's got to be the path of least resistance. Otherwise, you sort of just have to be like willpower all the time.
Yeah, absolutely.
I wouldn't mind actually going back to the actual big problem and the statement that we've made, because that's one of the reasons why I was so excited about actually being here, because I do think that we need to think about our healthcare system in a very different way. And that's one of the reasons why food in connection to that healthcare is so important, because you and I, Jason, we spoke about this previously as well, and we are doing the same with our healthcare leaders within Deloitte. We actually don't have a healthcare system in Australia or in the world, right? We have a sickness system, of an injury system. If anything happens to you, that's where you go. And I think the exciting part, and that's the opportunity that we have, is when we actually start to think about more integrative care, right? The preventative side of it, the recovery side of it. And when we think about integration, I think food has a massively important role to play. Because if we look at, and you spoke about the actual cost to the healthcare system, right, and the actual pressure that we're putting on the healthcare system as a result of a dietary related issue, the answer is not more hospitals, more doctors, right? We can do so much more in the preventative side, and that has, as you mentioned, a lot of different levers and a lot of different players, which is again one of the reasons why I like the job that I have, is the ecosystem that we can actually bring together to jointly, collectively start to make a difference there.
Yeah, so much of our discourse around health the last 2 years has been on a communicable disease, a specific communicable disease, but actually these non-communicable diseases, preventing those before they get to the stage where someone needs to be in hospital is, it's not just good for individuals, it's really good for a country's bottom line.
Yeah, just on the point about we don't have a healthcare system but a sick care, we spend $30 to $40 billion a year on treating chronic diseases, again, right, really the top killers in our society. And that's in comparison to how much we spent on prevention, right? So public health as a whole gets about $2 billion a year, right? So in terms of, that's all public health, not just diet, right? All public health, right? So that's only about 2% of our recurrent healthcare expenditure, right? comparable countries are New Zealand and Canada, spends about 6% of their healthcare expenditure on prevention. You see the gap there, right? Like, why are we spending so much on the treatment part of it once people are already sick, rather than putting more resources and effort into their prevention side?
So they're spending 3 times as much as we are in proportion
As
of GDP
proportion, that's right.
on prevention. Can you see what that translates to in terms of savings?
Yeah, so absolutely. So I guess that's going to your message about hope. I think there's a good point about it, is that we know that most of these population level diet policy, around prevention. So reformulation, I explained. There are other ones, like, for example, fiscal measures or economic measures. You can put some taxation on some of the less healthy products and use the money that you've raised to support the healthy foods, like fruits and vegetables. There's a lot of modelling that's been done on that sort of work, right? Billions of saving over the population's lifetime. That taxation and subsidy ones in particular. I think the latest figure I saw was about $3 billion over the population's lifetime. So serious money, serious saving that we could be having, and reducing the stress on the healthcare system at the same time.
Just adding to the business case component, because we often then think about the direct healthcare cost as being the big cost. But if you think about the productivity loss as well for individuals, either because they are sick or even if they are at work, still capable of working, they may not necessarily perform at the levels that we need them to perform. So in my mind, productivity cost translating into economic output is one of the bigger levers as well that we need to consider.
It can feel a bit cold to be really boiling this down to numbers, but I think people know that health is good. It feels good to feel healthy.
Yeah.
But also, in addition to that, you've got these really kind of cold hard numbers. So when we put out the call for questions ahead of time for tonight, and you can keep submitting your questions via Slido, the hashtag again, I have forgotten.
MedConnect Food Health.
Thank you. Hashtag MedConnect Food Health. Someone's been listening. We got lots of questions ahead of time, really great ones, and I'll put some of them to you in a minute. But we also got a lot of questions where people were like, can we talk about the health benefits of this particular nutrient or this particular antioxidant or this category of food? And I wondered whether it would be useful for us to just absolutely go back to basics of like what actually counts at a population level when we're talking about diet quality.
Do you mind if I?
Yeah, go for it. Absolutely.
Take this one? Cool.
Yeah.
So really, if you look across the world in terms of dietary guidelines that are in place, right, and this is huge amounts of work that are put in by nutrition scientists who review reams and reams and volumes of evidence around bringing it all together and synthesizing it, and you can really find commonalities across all these dietary guidelines done by different countries. We can sort of broadly put foods into, I like to think of 3 baskets, if you like, right? So there are things that are clearly good for us. Fruits, vegetables, whole grains, fish, lentils and pulses, right? And also things that are, and in the next basket of things are the things that are sort of somewhat neutral, right? Like, they're not terrible for you, but eating more of it also isn't a good route to health, right? So these include things like butter. And I would actually put butter in that category. We can talk about that a little bit more. Some other dairy products, so milk, for example, right? And cheeses probably fall in that category as well. Unprocessed meats, so you're kind of like poultry, red meat, that kind of fall in that sort of neutral basket again, right? I'm not saying that they're good for you, they're just in that neutral basket. And then there are things that are clearly terrible for you, right? So sugary drinks, processed meats, your salamis, your sausages, they've got tons of preservatives and salt added to them. You've also got things like really refined carbohydrate-rich products, right, which really dominate our supermarket shelves across most countries. So things like highly processed and refined breakfast cereals, white bread, for example, those things are clearly what you want to stay away from. So if you look across these kinds of dietary guidelines, that's really the consistent theme that comes out of it. And most of it these days is will emphasize on plant-based foods, right? Rich in plant-based foods with an occasional amount of animal protein sources. So that, I think, is at the heart of, in terms of what, if people want a dietary advice, that's what I tell people every time. Focus on those food groups. When you eat like that, it also means that naturally you're getting loads of antioxidants, loads of the good things that you want in terms of the beneficial nutrients. It'll be naturally pretty low in things like saturated fat, trans fats, and salt by following those kinds of dietary patterns.
So let's talk about, we know that that's good, and like you say, it's not really a massive surprise that we've fiddled around the edges of things like the food pyramid and that sort of thing, but the fundamentals of it haven't really changed in decades. So what can we do to help people make those choices? Because we've talked about the fact that it's not often the natural choice. Like, what can business do, and what can governments do to actually advance this? Vanessa?
So I might start with, because I think each player has a different role to play, and all will need to shift and many actually are already shifting. So if I start with food companies, the one in your bucket around the more processed components and sugary drinks as an example, one of the journeys that those organizations are on is around reformulation. So they really truly recognize that is causing harm to society in a way that they never intended to do. So they've been building reformulations as well as portion controls into their portfolios. They're shifting their portfolios towards healthier goods, and they've been on that journey for years and years. Still more to do, right? That's one of the sets of players. Another player that I think has an incredibly important role is the retailer in terms of curating what is actually available when I walk into a store. So that's to do with square meters that you actually dedicate to healthy product. It's to do with promotional activities where you place certain products. So we talked about reformulation just now and sugary content. There is a supermarket in the Netherlands. So my background is from the Netherlands. So Albert Heijn is the retailer, and one of the things that they've been doing with their private label is that they've actually extracted over the last few years 1 billion cubes of sugar out of their products, because they recognize the role and the responsibility that they have. And they go further than that as well to actually say, look, we've got an educational role. So they have score cards, for instance, that they place on products. They have articles that they produce. They have meal advice, for instance, to get people to understand that actually healthier food does not equal more expensive food, because that's an important myth that I think we really truly need to bust as well. And they just give you tips to make it easier to make the actual right choice, the healthy choice, the obvious and the easy choice for you.
Jason, I suspect you don't. I don't want to put words in your mouth. Is that enough?
Yeah, no. I look. I applaud. Look, the food industry is such a heterogeneous. Like we use the word sort of as an encompassing term, but there's obviously a diversity of people in that space, all the way through from individual farmers to retailers to food manufacturers, and I do applaud people who want to in an industry who want to do their part to help improve public health. But I think what's really lacking, in Australia in particular, is government leadership. We absolutely need much, much stronger government leadership. Let's just use COVID again as a comparator. I gave the number up front in terms of globally, right? We're talking 11 million premature deaths caused by suboptimal diets, right? Since the COVID pandemic, 6 million people have died, right? When it comes to diet, it's every year. Why aren't politicians, why aren't people who are responsible for healthcare shouting from the rooftop saying, we have a crisis on our hands, right? This is a real problem, right? So, and the way to tackle a crisis is you've got to commit all your resources into the fight, right? Not just sort of piecemeal solutions here and there. And I think food industry has a part to play, but the government needs to take that leadership, both from local, state to national government, to say we need to have comprehensive policies and plans in place, as I said, going back to the onion analogy, that supports the individual, it supports the communities, right? Workplaces, schools, that supports healthcare. We can come back to talk about a bit more what healthcare can do specifically around this area, but also more broadly, how as a country as a whole, how can we turn the ship around, so to speak.
Yeah. And I think the government is starting to recognise that. I'm with you, isn't there? So much more to do, but we've got levers like taxation, you've got levers like grants and subsidies. And if you think about the government as an institute, they're actually a massive procurer of food as well, as in the food that goes into schools, in public hospitals, and actually their own buildings as well. So they have a lot of levers to pull to actually make that change.
That's really interesting, because we were talking about reformulation. It's important, but it's also a really easy one to look at. And there's a real narrative around taking things out. Take out sugar, take out salt. But what I'm hearing you say is it's so important to put in fruit and vegetables, put in fish and healthy nuts and seeds and that sort of thing. So what's something, like, what are the strategies around that?
You want to go?
Yeah, sure, yeah. So again, look, there are it really comes down to individual institutions' commitment, I think, right? We can all do this, and I'll give you, I guess, 3 examples at varying levels. So at my work, again, at the George Institute, we've had a policy in place for, I think, 4 years now, right? We worked with our administrative staff. We had meetings with the whole institute to say, look, it's really important for us as healthcare leaders.
Yeah, you really need to.
To not just, I don't want to be the food police, right? But it's also really, really important for us to think about we're here researching and telling people, doing advocacy to say this is important for our health. When we spend our institute's dollars to procure our office lunches or work meeting lunches, let's, again, not saying that it's black and white, right? But let's just shift the proportion, right? So instead of always having a cake with those workplace lunches, maybe we'll only have it once every 2 months, right? And the relative proportion around the healthy versus less healthy, right? That's a good example. We've now taken it to a next step here at UNSW, actually, where we've got a good food project, which runs hand in hand with the sustainability element as well, right? So reducing single-use plastic, right? Don't use takeaway cups, but at the same time, right, putting in some institutional guidance or leadership to say to the individual retailers on campus to say, hey, again, work with us. We're doing the research around it. We're helping people to look at what are the things that you're selling right now. What are the sort of kinds of practices in your stores that could be improved? For example, for your 2-to-1 lunch deals, we're talking about a bunch of students, a lot of students here who are in particular very budget conscious, right? Sure. So can we make sure some of those deals are targeted towards water plus a salad, right? Or water plus a sandwich, right? Something that is going to be healthy and affordable at the same time. So those are the kind of examples, I think, we're at a fairly local level, but we can go all the way up through to, local government can do the same thing, right? So ACT, for example, have said on our public buses, we will not have advertising for certain kinds of junk foods, right? So saying that, again, you feel free to put those advertisements other places you like, but here where it's government property, we will stop those kinds of advertising. So there is just such a diverse mixture of policies that all kinds of stakeholders can think about putting in place and have a real impact all the way from the local to the national level.
Yeah, and one of the things I want to pick up on, particularly on what's available, what food actually do we offer, and then again we're trying to use bigger players to make bigger shifts and a bigger impact rather than letting it to the one institution to actually make that change. So food service companies, as an example, they have a massive role to play as well, right? So they provide the food and the meal curation, and the narrative and the value proposition that they build around that, I think is starting to shift quite dramatically. And we talked about business case earlier. One of the really beautiful things that I'm seeing coming through from food service companies is that they're actually going to talk about the benefits of healthy eating over and above just not getting sick. So that is to do with your mind, your productivity, as an example. So professional services firms like Deloitte, we need our people to really think clearly. Not the first part of this session wasn't necessarily there. I blame COVID, but usually we're sharp, right? We're on it, and that's a massive output in its own right. And even safety. I know that many of the food companies who supply food to mining corporations, for instance, the big risk there is safety of individuals. We know that if we give them better food, that safety incidents drop because people are concentrating better, right? So there's lots of ways in which we can start to shift the narrative towards the why of healthier eating, and then making sure that it's indeed then affordable and available, which is your other point earlier.
The point about sort of workplace one, another really interesting example I've heard in the United States is that their sort of obesity and overweight and chronic health issues are even really in some ways worse than Australia. And at the military levels, right, the American military, being able to have enough people who are able to serve in the military is in some ways becoming difficult because people are, in terms of the health conditions that they find themselves in. This food nutrition is becoming something on their radar because they're like, if we want to have a military that can service the needs, we need to have people who can actually be in the military. So it's beyond just sort of the chronic health issues. It's also about productivity. It's about being able to live the lives that we want to live.
Yeah, and then when we actually do get to a hospital, God forbid something might end up happening to you, then the food has another role to play in my mind, and that's another lever that we haven't pulled sufficiently. I'm not sure how often you you visit a hospital, but if you don't look at what's actually being offered, irrespective of why you're there and what condition you actually have, it's the same. And it's not necessarily that healthy, right? So how we actually think about curating meals and hopefully then also targeting the specific needs of those individuals based on their medical condition, I think is a massive one. And then subsequently, when they're an outpatient or recovery, what is the advice that we're giving them and equip them to actually then subsequently take care of themselves to either speed up recovery or hopefully reverse some of the impacts that it's had. And Jason, you and I were talking earlier, I think you're on the verge of an awesome initiative. Maybe you want to talk about that.
Yeah, so we've talked, I think, a lot so far about initiatives that almost happens outside of healthcare, right? We've talked a lot about businesses, we've talked about individual institutions taking leadership, the military even. But if you think about healthcare itself, right? So the phrase "food is medicine" has been around for a couple of thousand years, but really, for the most part, if you think about where our healthcare dollars currently go, right, we spend billions and billions into paying for medications, surgeries, right, these kinds of services. They're vital. Don't get me wrong, very, very important. But when it comes to supporting people to eat healthier, it stops at, well, we're just going to talk to you about it. Why don't we actually put some of their healthcare dollars into paying and subsidizing for healthy foods and evidence-based healthy meals? Because we know that, we've already talked about it, again, back to the onion, structural barriers to healthy eating, accessibility, affordability. Why don't our healthcare systems actually set up, to be able to have those programs in place? And in the United States, this is already a reality, so we're probably a good 5 to 10 years behind the US. There are programs called produce prescription, so doctors literally prescribe people with type 2 diabetes, people who experience food insecurity, to say, I think you need this probably a bit more than getting another medication to treat your condition. And there's some very, very promising data now that's accumulating to say actually it can be very effective. It can also be cost saving. So people who are put onto these, supported by these kinds of programs, have overall reduced healthcare expenditure. So not only is it good for the person, the individuals, but also good for the healthcare system as a whole. So here in Australia, we're now embarking on a number of programs where we're starting to roll out, testing these interventions in mostly focus on New South Wales right now, but hopefully we'll be able to scale it in the future.
Can we talk about that and dig in a little bit on that? Because so much of what we hear is about, or we can sit here and talk about, it's really important for people to eat like fruit and vegetables, and we live in capital cities and we have resources and fridges and kitchens and that sort of thing. We can take for granted those things and not every Australian has access to it. So ensuring food security and equity of access is so important. Like, what other tools are we seeing used overseas that we could look at here in Australia?
So you started off with the food and veg being important. I think one stat that is still astounding for me, and this is an Australian one, is that 90% of us actually do not get the daily intake of food and veg, right? So let's start with that. We've got a deficiency, full stop, that we need to address. But the reasons as to why we're not accessing that is different. And I think your comment around the vulnerable communities, lower income, perhaps rural as well, it's often a combination of both accessibility and then affordability. It's not about the willingness, as in even if you wanted to actually have healthy food, you may not necessarily get it. And I think that's a big challenge that we need to address. And I think government in particular will have a role to play in terms of curating from an urban planning perspective, for instance, the different types of shops or stores that you want to open, subsidizing access to the certain food, the infrastructure itself. Because particularly if we're talking rural, for instance, if you look at some of the food prices, which today's news around inflation actually brings that to the fore again, we know that in rural areas it is even more costly to actually access food, and that's often also where the population of vulnerable parts of our society actually reside, and I think that is requiring a big intervention.
Yeah, no, I agree with that. I mean, look, there are multiple issues here that in potential interventions around the sort of remote rural communities. And I think what's most important is to try and involve those communities in designing those solutions into what will work for them. Because as you already alluded to, right, what we think will work and what we have shown can work in the metropolitan areas may not work for communities that are further out. So local agriculture, is there a role for providing training to the communities, providing support by the government just to make sure that the foods don't have to travel as far, right, before it can get to them. Supply chain logistics, right, and that's where I think food businesses can have, they're the experts in terms of making sure things can get from A to B at the lowest cost and in the best condition possible. So, that's definitely an area that needs a lot of work.
So please continue to submit your questions via Slido, hashtag
MedConnect Food Health.
But one of the questions that we've got that's come through is sort of plays to this idea of food security. Peter Jennings is asking, at what point is the population going to outstrip our ability to basically meet the demand for food? What do we know about our ability to make food for the number of humans that we've got on this planet?
Yeah, so the Eat Lancet report that came out, I think a couple of years ago, have again shown very clearly that right now, for the population that we have more than enough calories to meet calories in the diversity of foods available to meet everyone's needs. So the main issue actually lies with distribution, right? So in terms of getting
not a small issue, though.
not a small issue. No, that's not a small issue. I absolutely agree, right? So, but in terms of just the capacity to meet the demand, we're actually right there. Going forward, I think it's going to be very challenging, and this is going back to the sustainability issue as well, right? We know that the way that we produce our food and the way that our food system currently works is actually also a major driver of climate breakdown, right? Which is we know we're already on the cusp of we've experienced all these droughts, all these flooding recently that we know is there's a high likelihood it's been driven by climate catastrophe that's happening. So whether we can sustain the level of production that's going to be needed to meet everyone's needs is always going to come down to how much we can get on top of the climate crisis, without a doubt. So again, the Eat Lancet report really highlights that to say that there's an interplay there in terms of both how we produce what we eat and how we transport our food and all of that, together with our ability to be able to continue to thrive and to be able to grow foods going into the future. So I think that's a really important thing to keep in mind.
Yeah, and the calories that you said isn't there, but it's not evenly distributed, or it's not necessarily. That's a very important statement to make. But for me, it's also the production, the way that food is being produced that we need to tackle. That has massive destructive implications to the planet. It's a monocropping. It's the agricultural revolution, which started many years ago with really good intent, right? It was to make sure that malnutrition actually came down, which we succeeded in doing by industrializing all of it. But we're now seeing that it had lots of side effects, and actually malnutrition is going up. So we might not necessarily been able to claim some of these benefits that we had for a short period of time. So I do think, again, that's where the food and agricultural industry can do a lot. We're seeing regenerative ag practices coming through, which then harnesses biodiversity, and it's technology as well that is able to actually help us there. And as much as tech, I think, in food can help the climate component, it actually is also really interesting, again, for the health of individuals, because when we think about how we manage our own health, technology, in my mind, is going to revolutionize that big time. And I'm wearing a watch at the moment, so there's a lot that is being measured about me, and there are lots more other technologies out there that could measure my state and actually give me prompters in terms of what I need, what my body needs. And that's an exciting space. That's precision nutrition and personalized nutrition that we can get into. And one example, and I'm sorry I'm taking you away a little bit from the sustainability, because I am totally up for that. That's a big one, but I want to stick with the healthcare component. One awesome example that I've seen, and it's currently within the UK in particular. It's a company called DNA Nudge. You might want to look that up if you've got some time available. But it basically is a bracelet, and it uses your DNA, or saliva in this case. So it's a relatively non-invasive part. It's not going down your stool or your blood, but it's your saliva. And based on that, they understand what your microbiome is. And if you wear that bracelet and you actually go out shopping, and you can shop at Tesco or Waitrose, you can scan the product, and your bracelet will tell you that based on your DNA, that product is good or not good for you, and actually can give you prompters in terms of what alternatives would be better for you. So if you combine all of these awesome technological advancements with the science of what we now know about individuals' body, and then on top of that, because we spoke about those nudge theories earlier, put on top of that the behavioral economics that we can actually prompt you to say, I know exactly what you respond to, because Jason, you're someone, if there's a competitive gaming component, you're on top of the ladder, you'll be much more likely to actually nudge in that way. And because I know that about you, I can tailor my engagement with you in a way that actually works. So anyway, I'm trying to paint a bit of a world that I think is going to be incredibly exciting and much, much needed when we look at our healthcare challenge that we have in front of us.
But we can't have 7 billion people with smartwatches telling them what to eat. So you've got this sense maybe where the rich get richer. It's incredible that we're able to do this stuff. It's amazing. That's precision nutrition, like precision medicine. But what about the rest of us?
Yeah.
Yeah, we've got to walk.
Yeah, no, look, I am not a Luddite, and I'm all for technological innovations where it can have a beneficial effect. I'm a little bit skeptical on the precision nutrition. We can talk about the literature there a little bit more. It's at an early stage. Again, I think there's definitely potential there for whether it's our DNA, whether it's our microbiome, and in terms of trying to tailor it to individuals. I think a lot more research needs to be done. And what I worry about a little bit there is the unintended side consequences, is that, again, we lose sight of the big picture. We lose sight of it. Just using microbiome as an example, because I get asked this all the time. What should I eat to help the bugs, right? All these trillions of bacteria.
Fruit and vegetables.
Right? and I hate to sound so boring, but it's...
you should just have one of those buttons on your desk that just says fruit and vegetables.
Or I could wear a t-shirt that says it, right? Like, the kind of foods, right, that the probiotics that we use to feed the microbiome, it's essentially fermentable fiber. And guess what we get the fermentable fiber from?
Fruit and vegetables
and whole grains, right? So it's I just don't want folks to lose sight of that big picture, which is we already know, like, sort of 80% of the way, I would say, we have a pretty good picture of the roadmap to health and well-being when it comes to diet. Absolutely, like room for additional research around supporting specific conditions, and then I also worry about that the implication for driving inequity as well. So as you say, like, well, all of us are going to be able to afford a smartwatch, right? And we really need to have, again, those system-wide interventions that's going to help lift everybody, as opposed to only the folks who can afford it.
Yeah, no, we do. Look, I'm not arguing with you on that one. But what I love about just knowing more, and education in the broader sense, right? So precision nutrition has that massive part of that part of the spectrum, but obviously basic knowledge is there. But for me, feeling empowered as a consumer, that you know what's right for you, and then not being worried about affordability, which is why I think cost of food we will need to look into and continue to look into. That's the ultimate key, I think, to unlocking so much potential. And on our personal well-being from a mind set perspective as well. If you feel empowered, if you know that you can actually do the right thing, if you want to do the right thing at that point in time, that's an important key.
Yeah, so let's talk about food as medicine. Like, there's the prevention side of things, and then there's also the kind of recovery side of things, which you sort of alluded to a bit. We talked a bit about prevention of things like diabetes, hypertension, sugar and salt. What other sort of things are there on the prevention end and then the recovery end?
So I mean, as you said, with so much of what we've talked about is on the fruit and vegetables, but again, going back to the entire dietary pattern, right? So a good example of a dietary pattern that's really effective for reducing blood pressure and therefore preventing future risk of heart attacks and strokes. It's called the DASH diet, right? Diet approach to stop hypertension, right? So nice and succinct, right? If you look at that dietary pattern again, so differently, fruits and vegetables, whole grains, healthy dairy, right? So low-fat dairy products as part of their dietary pattern, because dairy products, not only is it contain lots of healthy nutrients, it's also potassium is a particular component that's important that you get quite a bit of from dairy, and it helps lower your blood pressure. The DASH diet also talks about obviously keeping an eye on your salt intake, right? So make sure that you don't have too much salt, and that's been proven again and again, right? And in hundreds of trials, it shows that even within a short time period, right, 4 to 6 weeks, you can see reduction in the amount of blood pressure for people with hypertension and also just the general population. To be honest, when it comes to recovery, You'll hear me say the same thing again. The evidence does not change a whole great deal, right, around in terms of what will help you to recover from that stroke, from that heart attack, from the diabetes. The healthy sort of foods that are good for us really don't change a huge amount. Again, there's cultural sensitivity and specificity. Of course, we always need to keep in mind what foods people are actually going to consume and they're going to enjoy eating. But really, the basic dietary pattern don't change a lot.
I'm glad though that you could have pointed out some of the benefits of dairy as an example, because the danger is when we say it's neutral, if you're putting it in a neutral bucket that we actually don't necessarily need it, and it's all about fruit and veg, because I just want to make sure that actually we have foods within that neutral bucket that are critically important, right? Red meat as an example, we know it also is being debated,
so
but it actually
could qualify. Dairy is part of that healthy dietary pattern. It's not on its own. It's not on its own.
Because there are lots of components, and I think people may not necessarily fully appreciate what the benefits of these products are. And just a glass of milk as an example, if you are a runner, marathon runners as an example, they might take a product that has electrolytes in it at the end, a sugary type product, but actually milk might have more electrolytes, a glass of milk, than one of those specific sport drinks might have, right? Not many people know about that. So as much as I like your simple view, I think there's lots to be done still around educating them on the benefits beyond food and veg.
It also was interesting you mentioned cultural factors, or one of you did at least, and this sense of people like to say food is fuel, but it's not. It's not. It's memories and culture and connection and comfort, for better or worse, and yes, it's fuel as well. And how that plays into these conversations we have, especially when we're talking to different cultural groups and trying to educate people.
Want to go?
Yeah, look, I'm not a cultural anthropologist or anything like that, right? It is obviously. I mean, again, though, if you look at the way that our traditional diets around the world, again, there's a lot of commonality in terms of where we've all come from. Right? So a lot of plant-based food products, food groups tend to be the traditional dietary pattern, right? So your sort of whole grains, healthy grains, your lentils and your pulses, fruits and vegetables, right? Like, look, again, I'm going back to the same thing, but it's true, right? And in many ways that as countries tend to go through that development or economic development trajectory, what you tend to see is that those diets start to get displaced, and more we shift towards a quote-unquote Western dietary pattern, which is dominated by highly packaged and processed foods, more meat-based products. So there is a commonality, again, in terms of, even if you go back to most countries in terms of their traditional diet, there's an element of that. A lot of it is healthy, right? A lot of it can be culturally appropriate because people are used to eating those kinds of foods. But obviously, it'll differ again, right? From country to country, from culture to culture.
We do hear a lot about the Mediterranean diet, but
it's
actually there's so many commonalities.
Yeah.
It's just really well studied.
Yes.
Sorry, Vanessa, you go though.
No, I love where you when we're saying it's more than fuel, right? And food is emotion, and that's the part that I love, and the reason why I love food, because we share it with others, we understand the food, and I also think that is one of the areas where we can do a lot more with societies, to connect them to the story of food and connect them to the land and where it's from. And the more you understand, the more you start to appreciate it, and the more value that the sharing of that would have. So that's that's another area that I think opens up a lot of opportunities.
Yeah, opportunities to connect it to storytelling and
Yeah.
that cultural connection.
That's right. And I'll give you one other study that we laughed about. Well, I've got 2 kids, and one of the studies was done in America for school kids, and they asked about where chocolate milk came from. And I'm not sure if you want to have a guess with what
Brown
the answer
cows.
is. Brown cows, right? So yeah, funny. We had a good laugh about that with our kids, but for many kids that's actually reality. So that means that there's such a disconnect to the food, and having long supply chains that we currently have in the world, which is basically a result of that industrialized agriculture, where you say we're going to produce the food in the most economic parts of the world, which is also why you have the calories unevenly distributed. That played a part and provided us with benefits, but I think it's time for us to actually start to get back to food, back to the land, and start to produce food more locally as well, and a diverse set of foods.
So I'm going to start taking some questions from Slido, and we'll start with this question who says, anonymous, who says, I try to avoid preservatives, but are they as bad as I think they are?
Yeah, look, the science on preservatives, I mean, there are all kinds of preservatives as well, right?
I mean, salt is a preservative.
Salt is a preservative, so is citric acid, right? So like, and sometimes, there's a whole diverse range of things that people use in food. So it's a bit hard to just kind of say blanketly they're all bad for you. But absolutely, I would say, look, if you pick up a packaged food product and you turn the packet around, you look at the ingredients list, and it's full of 1,000 ingredients, most of which you can't pronounce. There's probably a good chance that I would personally say that's probably not the route to the optimum nutrition, right? and a lot of those would be preservatives that when it comes to processed meats, for example, there's pretty good evidence that eating more processed meats leads to all kinds of chronic diseases, and it's quite likely it's due to the types of preservatives that are found in the meat products, right? Nitrates and sodium, for example.
Is that something that industry is working on reducing, or is that something that can come into reformulation, or are they a necessity if we've got things that are packaged and processed?
Yeah, well, it depends is the answer. But there's already, with the rise of the health conscious consumer, there are already trends around getting towards more natural products, or less of, or free from, right? We had a whole trend for a while that basically advertised a product not with what's actually in the packet, but what is not in the packet, right? So I would definitely say that's a continuation. But look, it was a hard question to get. You did a great job in answering, but I think there's a bit of a simplistic view that we can bring to that as well. It's basically saying if you do it in moderation, you should actually be fine. It's when there is a degree of overuse that we start to actually see the issues arise from a healthcare perspective.
Yeah, similarly, because there's a theme here. Another person saying that they hear that there are insufficient vitamins in food, and so should we be taking supplements? Which vitamins are the key for living longer? Well, supplements is a very interesting topic. Do you want to start there? Or
yeah, maybe I'll have a quick crack. So, look, if you eat what is, again, a dietary guideline recommended kind of dietary pattern, you should never have to worry about being vitamin deficient, right? For the general public. There are specific times and people with specific conditions or even dietary approaches that they follow where supplements are called for. So pregnant women with folic acid, that's a good example, right? So supplements do play a role for specific populations. People who are vegan, vegetarians, you first of all, you need to think very carefully about making sure that you are nutritionally complete and you're meeting all the macronutrient requirements. And sometimes, again, supplements could be useful for people who are vegans and vegetarians, for example. Just a couple of examples, right? Iron, vitamin B12 as well. But really, though, overall, the use of multivitamins, for example, there's very little evidence to suggest that, again, it's going to be useful preventing these major diseases we're talking about, cardiovascular disease, cancer, type 2 diabetes. A major trial was just published about 2 months ago, again, another 20,000 people, right, randomized to take multivitamin or not, and what they found is that didn't zilch, nada, right? Like 5 year, 6 year study, long-term follow-up. So overall, I would say, if you really want to, in terms of improving your overall health and well-being, think about your overall dietary pattern, a little bit less attention on the supplements. Otherwise, you just end up getting what I think was ABC actually covered. You're saying very expensive urine. We'll just end up throwing it all out.
I can't take care of it. It sounds good.
But it does have a role to play, and as you say, it can never replace a healthy diet. That is the first thing. But we also know that we've got 90% of the people not actually getting access to a full healthy diet. So there is a deficiency in nutrients that supplement can play a role in. The other part is that certain medical conditions might actually require you to get access to certain vitamins or supplements or nutrients that are in doses far beyond what you could ever get out of a diet. And that's something to consider as well. And it's an industry that is growing massively as part of that whole conscious consumer trend that we're seeing. We're now spending more on supplements and well-being related product than we do on prescription medicine, and that's for the first time that we're seeing that shift taking place. And I don't see it slowing down either. But what I do like to see, what we're already seeing, and it comes back to some of that personalized component, is you don't always know what you're deficient of, and therefore what type of products actually suit you. And without knowing that, you might end up taking things that create expensive urine to stay within your description.
And actually potentially for active harm. So there's a really famous research really in the sense that people used to think beta carotene, which is the kind of chemical you get from colorful vegetables like carrots, is the best example. And because there were observations that people who had more beta carotene in their diet, maybe a lower risk in observational studies, right? That they had lower risk of developing lung cancer. But then people did an actual randomized controlled trial, and the group that received the beta carotene actually had a higher risk, right, of developing lung cancer. And then people went, whoa, like, I guess I tell that story because the reductionism can be not just neutral, like it can actually be actively harmful. So we need to actually be quite careful. I think getting the help of health professionals, so seeing your dietitian, seeing your healthcare provider and say, do I actually need to take supplements, is definitely a good starting point. But also I guess it's important to keep in mind that it isn't necessarily just neutral for you, so it could actually lead to harm too.
We've actually got a couple of people asking similar questions along the lines of like, must a healthy diet be expensive? Does it have to be expensive to be healthy?
Yeah. Sorry, go ahead.
I think it's this is and I think we raised the point earlier. There's this misconception out there that it is cheaper for you to go for unhealthier food, particularly when some of the quick service restaurants have certain deals on and look like, hey, I can feed my entire family for this, and therefore if I were to actually go to a supermarket, it would be more expensive. Reality is that if you look at the studies that are taking place on that topic, including the ones here in Australia, there is no proof that there is a disconnect between one being more expensive than the other. But it is to do with understanding how you can actually feed your family healthy in a way that is affordable and doable. So I think there's a lot to do, again, around the advice and education, curation of meals, and in particular for a grocery player as well to have a role within that. Jason?
Yeah, 100% agree with that. There's also an issue around how you measure the cost of diet, right? So if you go down purely to a caloric-based metric, some of the ultra-processed, really unhealthy foods can appear to, because that's basically all they're packed on. It's just, there are no other useful nutrients, but packed for just pure
energy.
Calories, right?
Yeah.
But if you take a broader picture in terms of, well, we know the things that are good for us are these, useful phytonutrients and antioxidants. If you take that broader view in terms of calculating, cost of diet based on what's going to give you what your body really needs, then you can get a very different picture. So yes, I agree. There's no evidence that, at least the evidence that we have so for now, that it's absolutely more expensive to eat a healthier diet.
We're nearly out of time, but what I'd really love to sort of end on is a bit of a positive note, I suppose, is if we were to make one big change in the next 5-10 years, what do you think it should be to actually have the biggest effect on Australians' health? We'll start with you, Vanessa.
We opened up with saying this is a multitude of
you only get
complex problem, and it's got multiple parties. I would say it's to do with that empowered consumer being able to actually make the healthy choice, the obvious choice. And education to begin with is a good starting point.
Jason?
Just to leverage off that theme, I would like folks to think of ourselves as more than just consumers. We are citizens, we're advocates, we can all play a role in trying to fix our food system. So in addition to educating yourself, use your wallet to purchase foods from your local food provider, think about the individual companies where you're buying from, what are their practices like. You can take leadership in your workplace, in your schools, push for change to say, I want food to be center of what we do as an organization. That's right there in the agenda mix. Think more than just being a consumer.
Thank you both so much. And on behalf of UNSW Medicine and Health, thank you to all for watching, listening tonight. Thanks to Jason and Vanessa for being part of this discussion. It's been such an interesting one for me. It's both more complex and simpler than I think I thought it was going in. We hope it's been interesting and entertaining, and I hope that you leave here with some food for thought. This webinar has been recorded and will be emailed to everyone who pre-registered. Share it with your friends. Please look out for information on future MedConnect events later in the year by following @UNSW Medicine on social media. Thank you again and good night.